Have you take a nice deep breath out and hold it. Very good. And that is 5.5 centimeters in diameter, which is a normal finding. Thank you. Okay, now I'm going to go over cardiac. I'm going to listen to your 5 valve points, listening for S1, S2, and abnormal finding would be S3 or S4. And also have you go on your side and listen for any further friction rubs or murmurs that maybe would be better heard on your side.
Okay.
So starting at your aortic, I'm going to move my way through. Aortic. Pulmonic. Nerves point. Tricuspid. Mitral. S1, S2 heard on all 5 points. I didn't hear any S3 or S4 in any of those points. I'm actually now going to have you lay on your side. You're going to listen to your apical point. Again, that's where I would hear friction rubs or murmurs at best. So I'm going to come around. Might be a little bit easier to reach. Very good. Negative for any sort of murmurs or friction rub.
Okay.
I'm going to have you sit back up. Thank you. I already did your carotids, but I'm going to go ahead and listen to his, feel for his peripheral pulses, looking at radial and brachial, and further on in the assessment, I'll do his bilateral lower extremities as well. So now I'm going to palpate your radial pulse, nice and strong, and equal bilaterally. Going to brachial. Nice and strong, equal bilaterally. Very good. Thank you. Okay. And typically I would go ahead, when I was doing those 5 points, I would listen to not only I listen to the diaphragm and the bell. But for this purpose, we're going to skip that. I'm now going to do an inspection of your abdomen. Okay. So I'm going to have you lay back on your back, make sure there's a pillow underneath you, get comfy. I'll start with inspection, then I'll move to auscultation, and then I'll go into palpation, because I don't want to disrupt any bowel sounds. So I'm going to have you just lift up your shirt just a little bit. I'll clean my hands, nice and clean. Okay, looking for any abnormalities, make sure there's no masses, lesions, rashes, anything out of the ordinary, which looks fine. Nice skin tones. I'm going to go ahead and listen. Very active bowel sounds.
Hungry.
You're hungry. Okay, I'm going to do light palpation. Let me know if there's any tenderness or pain when you feel me touch. Okay.
No. Okay.
I'm going to go a little deeper. Let me know if any pain.
No.
On your aorta, abdominal aorta, which should be 2 centimeters. Very good. Bring it down just a slight bit. I'm going to go ahead and palpate your spleen.
Okay.
Measure your liver span. And also palpate your bilateral kidneys. So first, the edge. So I'm going to have you breathe in and blow it all out. I should feel the outer edge of your liver there. Good. wrong side. And that appears to be 7.5 centimeters in diameter. Very good. Any pain? It was nice and smooth.
Yeah, no pain.
Okay, good. I'm gonna go ahead. Feel your spleen. Any pain?
Nope.
Okay, good. Now I'm gonna go ahead and feel your kidneys. Breathe nice and normal. Good. Good. Okay, and actually I do need to do one more test. I'll have you sit up. I'm gonna check for any kidney tenderness, so I'm just gonna kind of give you a nice little thump on the back of your kidneys. You shouldn't have
Sure.
any pain, but let me know if you do.
Okay.
Any pain?
Nope.
Any pain?
Nope.
Good. Since I have you there, I'm just gonna have you go straight forward. I want you to bend at your spine.
Okay.
I'm just gonna take a look at your spine. Nice and symmetrical, no kyphosis or scoliosis. Okay, very good. Any pain with that movement?
No.
Okay.
Okay.
Let's see here. Let me think. No, you know, I forgot to percuss. I'm gonna have you lay back down, unfortunately. Back on your. Just forgot to percuss. I did say that earlier, and I just didn't do it, so I apologize. So I'm just gonna percuss. So I should be hearing dullness over all the organs. That would be a normal finding. And assessing for any tympani. Very good. Okay, sorry about that.
No problem.
Okay, do a little hand wash there. Okay, moving along. We're gonna do some strength, reflex, and range of motion for the end stretch of this, okay? So we'll start off by first, I'm gonna test your arm strength.
Okay.
So I'm gonna have you do this, and I'm gonna push down, and I want you to let me pull up,
Okay.
good, and then the opposite.
Okay.
Very good. I'm just thinking with your elbows and don't pull out, okay, very good. Okay, relax. And then we're gonna have you go forward with your neck, backwards with your neck, turn side to side. Good. Any issues with that?
Mm-mm.
No. I'll have you flex your legs or your arms back, and then put your arms out in front of me, and then I want you to supine. Very good. I'll just push on
So-
you. That's okay. I'm gonna push against you again. Very good. Put your arms up. Good, and flip them back and forth. Very good. And now to the sides. Do the same. Flip them back and forth. Very good. And then I want you to move your fingers
Okay.
too. Any issues, I'm going to have you actually flip them around
Mhm.
and give you a nice squeeze, out, squeeze. Any pain or issues with that?
No.
And I didn't notice any edema earlier when I was inspecting. And again, when I'm looking at your arms, it doesn't look like any redness or tenderness. Any issues when I touch your joints there?
Mm-mm.
Good. Joints, joints, joints. Okay. I'm just going to go ahead and do the reflection or
Okay.
reflex tendons. Starting with your brachial. Good. 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 Other arm. We'll start there. Okay, brachial. Excuse me. Brachial. Triceps. Okay, good. Relax. All right, now I'm going to go ahead and I'll finish up with the reflexes, and I'll have you stand up and just look
Okay.
at here. Okay? Looking at patellar. Good. Other arm or other leg, excuse me. Good. And Achilles. Make sure I hold your foot up. Good. Other foot. Good. And now I'm going to palpate your DPs, or dorsal pedis, posterior tibias. Good. Strong, nice and strong. Those tips. Strong. Strong. Very strong pulses. Very good. And equally. Okay, I'll have you stand up for me. And we're going to go ahead, I'm going to do some, I'm going to have you hold, actually, you can hold on to here.
Okay.
We're going to do some abduction and adduction with your legs. So you can see me in the camera here. Okay. First, I'm going to have you take your right leg and move it across your body in front of your left leg. Good. And then out as far as you can to the side. Very good. You can bring it back to neutral position. Then take your left leg, do the same thing, reach across your right leg.
Okay.
Very good. Any pain or issues?
Nope.
Good. I'm going to have you bring it out all the way. Okay, it's still holding on there. I'm going to kind of see, test your strength. So move it out and don't let me push. Very good. And now bring it in and don't let me push. Very good. You can neutral. Okay, move your leg out. Don't let me push. Good. And bring it in, or excuse me, I did the opposite.
Sorry.
So bring it out, don't let me push, okay, and bring it in, don't let me push. Very good. Okay. Okay, I'll have you sit down. I have a couple more things I need to addendum. I'm going to do some sensation with you, and we're going to go through and let me know if you feel dull or painful pain or dull sensation.
Okay.
Okay? I'm going to have you close your eyes, which you already have, thank you, and let me know where I'm touching you, or if it's, excuse me, pain or dull.
Yeah. Sharp.
Good.
Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay, very good.